In this video, we'll first discuss the definition of fibro-osseous lesions, and then we will discuss two different ways how to classify the fibro-osseous lesions in your examination. So first of all, coming on to the definition. Now, in the definition of fibro-osseous lesion, you must mention that it is the replacement of the normal bone by a tissue consisting of collagen and fibroblasts containing variable or various amounts of mineral substance, cementum, that may be bony or cementum like. All right, so basically we are replacing the osseous part with the uh, fibrous part. All right, so this is the meaning of the definition. Now let's talk about the classification. For the classification, first classification is based on etiology. Now, first of all, the one which is due to genetic abnormalities. So it can be cherubism, osteogenesis imperfecta, achondroplasia, Marfan syndrome, Clausen syndrome, Apert syndrome, then tricho-osseous, trichodento-osseous syndrome, Treacher, Collins, France, Shetty syndrome, Down syndrome, cleidocranial dysplasia, then also osteopetrosis. All right. Now this is the first one, which is due to genetic abnormalities. Now let's talk about another etiologies. So the second one is basically because of endocrinal dysfunction, that is hormonal imbalance. In this, we will mention about hyperparathyroidism, hypoparathyroidism, dwarfism, gigantism, acromegaly. Now we will mention about aging. In aging, basically osteoporosis and osteopenia, then nutritional deficiency, rickets and scurvy, then infections, osteomyelitis. I have covered this in my previous videos. If you want to understand it, you can watch them. Then the diseases of questionable etiology. Diseases of questionable etiology. This will include the Paget's disease, Caffey's disease, osteoradionecrosis, massive osteolysis, aneurysmal bone cyst, traumatic bone cyst. Now we will discuss another classification which you must mention in your exam, because it is really very important to mention this classification which I'll discuss now. So classification number 2. First, this was you can also mention this was given by Waldron, CA et al. In 1993. Okay, so the first one is fibrous dysplasia. Now, in fibrous dysplasia, either it can be monoostotic, polyostotic. Now, polyostotic we also know is further Jaffe-Lankenstein type, or associated with McQueen Albright syndrome. Then it is also craniofacial. Then it is also cherubism. Now, this is a questionable thing. Basically, cherubism is juvenile fibrous dysplasia. If you look at it, it is familial juvenile fibrous dysplasia. We'll discuss when we talk about cherubism in next video. So, in the second one, you will mention about the reactive dysplastic lesions arising in tooth-bearing area. Here, basically, cementosseous dysplasia you have to mention. So, periapical cementosseous dysplasia. Then, focal cementosseous dysplasia. Florid cementosseous dysplasia. Now, in the third one, you will mention about the fibro-osseous neoplasm. So, this you already know. Cementifying fibroma, then ossifying fibroma, then we have cemento-ossifying fibroma. Then you will mention about the neoplasms, the benign and the malignant. In benign, you will mention about osteoma, osteoid, osteoma, then osteoblastoma, here osteosarcoma, Ewing sarcoma. Also, you can also mention the chondroma here and the chondromyxoid fibroma. So here you will mention chondrosarcoma. So this completes the classification. I have talked about 2 classifications. All right, the one with etiology and the one pertaining to the disease. Okay, and it is very important and will fetch you extra marks if you mention the definition of fibrosseous lesions. I hope you understood. Thanks for watching.